specifically in terms of chronic neglect, we undertook some research with Dartington Social Research Unit in 2011 and examined all the children that we took into care in that particular year. And what we found was that 30% of those were under 5. 2/3 of those children were newborns, so small babies, and 62% of those children had a main concern of abuse or neglect. The other thing that was quite stark about this group of children was none of the people involved in evaluating those cases felt that they could have been diverted away from coming into care. The other big thing that came through was 67%, so almost 70% of those parents had a substance misuse issue, and a further almost 30% had a parental mental health issue. So, I suppose relating back to what my colleague Simon said, in terms of gathering the evidence, we had some quite strong evidence that this group of children and this group of families were not well served by the current system, because we had a large number of them coming in and there was a feeling that they could not be diverted away from care. We repeated some of that work ourselves and found actually that the sort of percentage of children who were under 5 had actually risen in the following year. So about 50%, 49% of them were under 5s. Most of them were subject to care proceedings. And again, we had similar needs and similar sort of proportions of need around parental substance misuse. The other examination that we undertook was looking at our children on the Child Protection Register, and again, just under half of those were under 5 and with exactly the same issues. So gathering that evidence together, we then had to think about what do we do to solve this issue, because it's been with us some time. As I said, we weren't terribly happy with the outcomes that we were getting at the end, both for the children and also organisationally. So thinking about what we found out about those young children and the low chance of diverting, probably, what we felt was we needed to design a solution that really looked at a very swift assessment, gave those children a significant boost to their development, because the other kind of factor that was quite prevalent was those children were quite delayed by the time they hit statutory services, and offered significant intensive interventions that gave the parents the chance to turn those problems around quite quickly. So whilst we were looking to turn around those families, we also were very clear that the timescale of all the interventions that were delivered were within the child's timescale, so that if the parents didn't make the required changes, then those children were swiftly found permanent alternatives. So as Simon's talked about a little bit there, this sits as part of that joint commissioning strategy. That allowed us to develop a jointly funded and a jointly commissioned service between the Council and the NHS, and it allowed us to slightly extend the remit from the intensive service we talked about to include some preventative elements as well. That is a team that includes social workers, health visitors, drug and alcohol workers, mental health workers, speech and language therapy, and is currently managed through the council. It also includes something called a family drug and alcohol court, which enables the care proceedings for those children where that is necessary to be run in a very different way. So on board and as part of the team, we also have a district judge who sits locally 1 day a week. Another element of that is something called the Journey into Early Parenting, which is an intensive health visitor-led programme for vulnerable parents and their children, which includes drug and alcohol expertise and mental health expertise, and targets those families where there is a likelihood that neglect might occur. Not surprisingly, that includes a number of young parents as well. Early indications for both the Family Drug and Alcohol Court and the Journey into Early Parenting are quite positive. The sorts of early things that we're finding is 100% engagement with the Journey into positive parenting, which is quite surprising, because a number of those families their children will have a child protection plan. They will be quite high needs, but there's something about that Health Visitor-led programme which allows those families to engage and stay engaged. In terms of the Family Drug and Alcohol Court, I'm always very cautious about making big claims for this, because the numbers that go through it are quite small, but actually more parents are changing their drug misuse habits and are succeeding than would have succeeded had they gone through sort of a mainstream court and social work process. And where they aren't, parents are tending not to contest, which then speeds up the route for the children. Some of the things that have been striking that we probably didn't think about at the outset of this was the role of health visiting in this, both in the Health Visitor-led programme but also in the court process, as being absolutely crucial and vital, given their expertise in the areas that they cover, like child development and boosting child development, and speech and language therapy, which seems to be pretty crucial to both of those services. Early identification of interaction problems, early identification of parents who are not able to interact kind of positively with their children and encourage that language and communication development seems to be absolutely key. So that was kind of what we did. We've got some quite strong outcomes for this service in terms of we are looking for reduced numbers and periods of time in care for those children who come through this service, alongside reduced incidence of parental substance misuse and poor mental health. The reduced length of care proceedings allows us to think about reinvestment, because care proceedings, time children spend in care without a permanent solution, costs. What we're able to do is cost what we might have spent normally against what this service costs, and then start to think about, okay, there's a saving there, and it offers us the chance of reinvestment. In terms of the children themselves, we are also expecting quite a significant increase in their level of development. Again, that's important to us because those children won't just trigger interventions which will cost the council and the NHS money in the short term. There's also a longer term impact here. So if actually we can boost their development and they enter school ready, we then won't incur costs around SEN and things like that we might do. And as I'm sure that we're preaching to the converted here, but improving speech and language development in young children has significant payoffs later on in life in terms of offending. So part of what we thought about, and part of why I think we managed to secure the investment that we did, because there is some additional investment as well as investment that was already there in various services, was thinking about outcomes as a pointer to reinvestment. So, as I said, less time spent in care, less cost, but also less cost in things like instructing experts in care proceedings. That allows us to be able to have the room to be able to invest in something like this. Permanence more quickly being achieved, as I said, is not only good for the child, it's also good for us as organisations, because it means that we're not putting in, essentially monitoring services and services to maintain people. In terms of child level outcomes, and it's always interesting to think about this wouldn't necessarily yield savings to the NHS and the council in the short term, but actually perhaps for partners and society around reduced offending. We know that the children of parents who misuse drug and alcohol are likely to go on and do that unless somebody does something to turn that situation round. So in terms of reduced offending, improved engagement with education and society, and also some of the less legacy costs and the legacy for the child around spending long periods in care, maybe having placement moves. So we do have an outcomes evaluation framework to carefully track the child and family improvements, and we will robustly calculate cost avoidance. So in terms of the specialist service, the tax, the sorts of areas where we look to see savings would be in terms of reduced time spent in care proceedings. And obviously care proceedings are hugely expensive to local authorities. You know, instructing experts can cost anything from between £7,000 and £30,000. If we are, you know, we don't have to instruct experts when things come into the Family Drug and Alcohol Court, because all of that work's done. So immediately you see some savings there. Again, in terms of finding permanence, if a child is spending less time in care and having intensive work in terms of boosts to their development around speech, language and communication, you know, it's much easier to secure permanence for them. Therefore, you're sort of kind of making savings in that area as well. Certainly around the journey into positive parenting, we're fairly sure that some of those would have gone up into care proceedings, but actually they've been turned around at an earlier stage. So we're getting a bit of a preventative save there as well. In terms of wider organisational savings.
Yes, well, I think there's elements of cost avoidance, so we anticipate that if we make a positive impact on these children and families, their demand upon other services in the system, in the health and care system, whether that be substance misuse services or other services, or the criminal justice system, will reduce. Those are less easy to calculate, but nevertheless we think they're very real, and we hope to gather as much evidence as we can about that. But we also are looking for very clear efficiency gains around the use of the workforce. The early years workforce is considerable, and these changes are designed to get the most out of that capacity as a whole, so that the workers are much more complementary in the way they work with each other, with children and families, and reducing the overlap that can sometimes take place.